I think that health psychology is a fantastic area, especially for students these days. We have an enormous health burden in Australia, and of course over the next couple of decades there's going to be an increased need for psychologists to be working in the area of health, particularly to try and help with some of the lifestyle changes that go along with poor and chronic disease. There's a huge burden of disease with chronic health problems, and psychologists are well versed to be able to work with those populations and those individuals and groups.
With an ageing population, as people get older, they're more likely to have chronic disease and then struggle to cope with that, and then managing their chronic disease. And so there's a real need, an increasing need for health psychologists to help people in that area.
I visit 4 different locations around Sydney, so it's pretty busy. And then the other times I'm either following up with people's health professionals or spending time doing the research piece, or doing other things, projects here and there, consulting projects, teaching. I've just been doing some online teaching for Sydney Medical School on the psychological aspects of diabetes. So it's very diverse, and that's one of the lovely things about health psychology, is you can have a whole lot of different things that you do. Health psychology is tremendously satisfying. I find it very satisfying. If you like to see what you do have an impact pretty well straight away, I think health psychology is a great choice. You work in teams, have opportunity to work in medical teams, in hospitals, or out in the community. And teamwork's great fun. I mean, there are some times when it's a challenge, but most of the time I just love working with, doctors and nurses and other allied health professionals in a team around a patient to help them. I love it. I never get bored. And I would highly recommend a psychology student take a good look at health psychology as an option.
It's very much a multidisciplinary area where you're working with and learning from people in other disciplines, and that's something that's really exciting in learning how psychology can be a part of that team, and is also really valued by other members of the oncology professions like nursing, medicine, social work, occupational therapy, the radiation therapists. So there are many different professions that are involved, and that's something that you can really be part of, a field that's really at the cutting edge and leading many of the advances in health psychology.